Good afternoon. My name is David Blackburn. I'm your Bell County Judge. I'd like to provide you an update today on the COVID-19 situation in Bell County. I'd like to call on Dr. Amanda Chadwell, Director of our Bell County Public Health District, to provide you an update on the Bell County situation. Dr. Chadwell.
All right, so the situation in Bell County, as always, I will go through the state, federal, and local numbers. And as you all know, we've been updating those numbers on our website at 2 o'clock. So those numbers were updated at 2 o'clock today, and we have 16 total cases that have been reported in Bell County as of today. And we will update that again tomorrow to reflect any further updates. I can report that, as some of you know, there was a positive case reported in a nurse care facility. There has been an additional nurse care facility that has had a positive in conjunction with Baylor Scott & White, who has been instrumental and a wonderful community partner. We were able to test the residents and staff at both facilities. We only found 2 staff members at one facility that did come positive. They are within that 16 that is reported on the website, and no other positives in either of those facilities at this time. There may be some additional tests pending, but we'll update if that turns out to be the case. Now, as of the update on the Texas website, there are 352 cases in Texas and 8 fatalities reported from the Department of State Health Services. Nationally, 33,404 total cases and 400 fatalities. Questions? Pause for questions for a moment.
Dr. Chadwell, this is Jacob from the Telegram. I was wondering if you can go over who are the newest cases. The data from the health district isn't really clear on who the newest cases are. Just kind of make it clear to everybody.
Sure. There was one case, now this is directly off the top of my head, so okay. I'm hoping I'm getting this perfectly right. The newest cases have direct relationship with those facilities that were reported over the weekend and tested over the weekend. And I do believe there may be one other community-based case. I think that was a Bell County case, if I recall correctly.
How many tests were done over the weekend?
Oh gosh, I did not include that on the DSHS website. There is data on how many tests were conducted. Now, as far as the tests conducted for those facilities, I do believe it was in the range of about 300.
Just to go back over the protocol for asking questions, if you would, again, everybody should have their mics on mute on your side of the screen. And when we get ready to respond to questions, or when we get ready to respond to questions, or if you need to ask another question, Dr. Chadwell, if you will unmute and ask your questions, and we'll try to respond to that. In addition, I'd like to make a couple other comments in concert with the numbers that Dr. Chadwell just mentioned. There were some reports earlier today that there were 61 cases in Bell County earlier today. We've been in touch with Bell County, with Baylor Scott & White Medical Center Temple, and they have identified 61 positive cases through that facility. However, they want to stress, and I want to stress, that not all of the positive cases are from Bell County residents, as the facility treats people from all over the area and the surrounding counties. So there are multiple counties included in that count. The next thing I want to mention is that as a result of the governor's announcement yesterday afternoon, or in addition to that, which was in essence to allow each county across the state to make its determination of the threat level that the virus is posing within their respective counties, and then to institute whatever necessary and appropriate measures the county deems advisable to protect the public health and safety. And that was in the governor's remarks yesterday at his press conference at 3 o'clock. Upon the advice of the local public health district and in consultation with multiple health authorities across Bell County, I'm here today to announce that I'm issuing Directive Number 3 in association with the Bell County Disaster Declaration that I issued on March 18th. This directive and order requires all persons to stay home and stay safe in accordance with the terms and conditions that are listed in the order. I'm going to go through those here in just a moment. And there are multiple exceptions within that order. And I'd like to highlight a few of those right now. And I'm going to read parts of the directive, which again, we should be publishing here momentarily if it's not already out. Because of the risk of the rapid spread of the virus and the need to protect our most vulnerable members of the community, this order requires all individuals anywhere in Bell County to stay home and stay safe, which means shelter in place, except for certain essential activities and work, to provide essential business and government services, or provide essential public infrastructure, construction, which includes housing. This order takes effect at 11:59 p.m., March 23rd, 2020, and will continue through 11:59 p.m. on April 3rd, 2020, subject to the the limited exceptions and terms and conditions that are set forth below. This directive may be extended if circumstances warrant such. First provision I'd like to highlight is under Section 1 of the order, which is all persons may leave their residences only for essential activities and to perform essential governmental functions or to operate essential businesses as are further defined in the directive. I want to underscore and highlight that we are not confining folks or requiring folks to be confined to their home for all purposes and all activities. As I just read, essential activities, essential governmental functions, essential businesses all still need to continue to operate. All businesses within Bell County, except those essential businesses that are defined below in Section 2, are required to cease all activities at facilities located within the county. For clarity, businesses may continue operations consisting exclusively of employees or contractors performing activities in their own residences, for example, working at home. To the greatest extent possible, all essential businesses should comply with the social distancing guidelines that are attached and include minimum 6-foot distancing for both employees and the general public. All public gatherings of 10 or more occurring outside a single household or living unit are prohibited, except as otherwise provided in this directive. What I'd like to do now is move on to the definitions for essential activities and essential businesses, which I would encourage everyone to read carefully because there are multiple exceptions and definitions associated with essential businesses and essential activities. Individuals may leave their residence only to perform the following essential activities. First, to engage in activities or perform tasks essential to their health and safety, or to the health and safety of their family, or to any member of their household. So, for example, obtaining medical supplies or medication, visiting your healthcare professional, or obtaining supplies needed to work from home are all exceptions to this rule. Secondly, an individual may leave their residence to obtain necessary services or supplies for their family or their household members, or to deliver those services or supplies, for example, food, pet supplies, or other household consumer products or products necessary to maintain the safety, sanitation, and operation of your residence. Thirdly, you may leave to engage in an outdoor activity, provided the individuals comply with social distancing requirements. Fourth, individuals may leave to perform work, providing essential products or services to an essential business, or to otherwise carry on activities that are specifically permitted by this order. And finally, individuals may leave to care for a family member or pet in another household. Those are all exceptions to the order requiring individuals to stay in their residence. In terms of definitions for essential businesses, and there are several listed here. I think we have 8 listed here for essential businesses. So I'm not going to read all of the section. Again, it's in the directive. There are multiple businesses identified within this section, but I will go over the categories. These are essential businesses defined by the order. The first is essential healthcare operations. That will be places like hospitals, clinics, dentists, pharmacy, pharmaceutical, biotech companies. And again, there's a fairly extensive list here, but it's essential healthcare operations are considered just that, essential. Second, essential governmental functions. All services that are provided by political subdivisions of the state needed to ensure the continuing operation of those agencies to provide for the health, safety, education, and welfare of the public. These are also exempted from this order. Essential critical infrastructure and activities. That's the third category of the definition of an essential business. This is work that is necessary to the operations and maintenance of the critical infrastructure sectors as identified by the National Cybersecurity and Infrastructure Agency, CISA, memorandum dated March 19th, 2020, and it is attached to this directive. And I'll also provide you with a website to find that directive also. This includes multiple activities across multiple sectors. Public works construction, residential and commercial construction, airport operations, water, sewer, gas, electrical, roads, highways. Again, there's a long list here of critical infrastructure activities that are exempted from this order. The next category is essential retail. And I'll spend a little bit of time on this because it's something that we get a lot of questions on in the past week or so. Essential retail are food service providers, including grocery stores, warehouse stores, big box stores, liquor stores, gas stations, convenience stores, farmers markets that sell food products and household staples, food cultivation, including farming, fishing, and livestock, businesses that ship or deliver groceries, foods, goods, or services directly to residences, restaurants and other facilities that prepare to serve food, but only for delivery and carry out. Schools and other entities that typically provide free services to students or members of the public on a pickup or takeaway basis are also excluded. Won't go through the rest of these, but gas stations are also listed as essential businesses. Automobile supplies, auto supplies stores, auto and bicycle repair, hardware stores, construction supply stores, again, are partial listing of some of the businesses that are listed there, are industry sectors. Fifth category, providers of basic necessities to economically disadvantaged populations. Businesses that provide food, shelter, and social services and other necessities of life for the economically disadvantaged or otherwise needy individuals are also accepted or included within the definition of essential businesses. Three more categories of essential businesses. Essential services necessary to maintain essential operations of the residents or other essential businesses. So things like trash and recycling collections, processing, disposal, mail and shipping services, plumbers, electricians, exterminators, just to go through some of the things that are on the list. All of those are defined as essential services necessary to maintain essential operations for either residences or businesses, and they are included in the exception. News media. Newspapers, television, radio, and other media services are defined as essential businesses. Finally, child care services. Child care facilities may continue to operate under this order. However, to the extent that is possible and practical, it is recommended that these groups as an operation, they consist of no more than 10 in a group, and that they be kept separate to the extent possible. I'd like to highlight a few more things in the order, and then I'll open it up for some questions. The order also suspends all delivery hour restrictions for transport to and from any entity that is involved in the selling or distribution of food supplies, food products, medicine, or medical supplies in Bell County for the next 60 days. If someone in a household has tested positive for the virus, the household is ordered hereby to isolate at home and follow the directives of their healthcare provider. Members of the household should not and cannot go to work or school or any other community function, provided that workers included in essential healthcare operations may continue to work in accordance with the CDC guidance. All persons are encouraged to take advantage of telehealth services offered by our healthcare providers, including expanded telehealth services that are now available to Medicare patients. Nursing homes, retirement homes, long-term care facilities, assisted care facilities are hereby instructed by this order to prohibit non-essential visitors from accessing the facilities unless to provide critical assistance or for end-of-life visitation. These facilities are also required to institute temperature checking for all staff entering the facility at least twice per day and to limit physical contact between residents in the facility whenever and wherever possible. For individuals who are 65 or older and individuals with compromised immune systems or underlying health conditions, the following recommendations are made. 1, remain indoors. 2, outdoor exercise activities should be solitary. 3, pre-screen all essential visitors. 4, do not visit homes or places with more than one person. 5, ask all visitors to wear masks. 6, follow social distancing guidelines. And finally, do not use public transit except in the event of an emergency. Daycare facilities may continue to operate, but it is recommended that groups in the facility consist of 10 or fewer in those settings and to be kept separate to the extent possible. This order shall be in effect at 11:59, shall be effective until 11:59 on April 3rd, 2020, or until it is either rescinded, superseded, or amended pursuant to law. That's some of the highlights in the order. I mentioned the CISA March 19th memorandum for businesses that are a part of the critical infrastructure system as identified by the U.S. Department of Homeland Security. I would encourage you to look at the U.S. Department of Homeland Security's March 19th, 2020 memo from Director Krebs. It is attached to the order. It can also be found online at www.cisa.gov/publication/guidance-essential-critical-infrastructure-workforce. You can, again, find it at that location. For those employers that don't know if they're considered, their workers are considered essential critical infrastructure workers, again, I would commend that to your reading. It has a list of those available. All right, with that, I will pause and take questions. So don't all do it at the same time, but if you would unmute your mic, I'll be happy to try to respond to the question. Jacob, it looks like from my end that you have unmuted. If not, we'll go to the next one. Megan. I'll pause for just another couple of minutes and then I've got a final statement that I'd like to make.
If you want to have them text me, I can relay the question.
If we're having, if there are some technical difficulties in terms of you getting the questions in, if you will text Paul Romer, I think you all have his phone number. He said he would relay the question and I'll respond to that. While that is occurring, let me go ahead and read my final statement with regard to the press conference, which is this. I'd like to close with this. As we live and as we work our way through this event, and we will live and work our way through this event, please remain calm. Please be considerate of your family, your neighbors, and your friends. Our ability to mitigate the spread of this virus through these orders and measures that I've gone over, in the end, really depends on all of us working together for the benefit of all of us. While you as an individual may not feel threatened or endangered by the virus, please think about your family, your neighbors, and your friends that are threatened and are endangered by the virus. I'd urge you to act responsibly in a spirit of kindness toward all. And again, I'd be happy to take any questions you have. Paul? I find it hard to believe with the number of reporters that I'm seeing on my screen that you have no questions. But I will assume that is the case here in about 15 seconds. If you do have questions that you were attempting to ask during this virtual press conference, apologize for any technical issues that we may have had on our end if that did occur. If you would get those questions to Mr. Romer, we'll do our best to respond to those very quickly here because I know you all have deadlines that you need to meet. So if you get those questions to Mr. Romer, we will be responsive. Thank you very much for your time today.